Well, earlier this year, the Prime Minister announced a long-term plan for the future of the National Health Service based on extra spending in particular. Here at the Reform think tank, we believe that new ideas, new thinking will be even more important actually than the extra funds for securing the future of the health service. And in this video, we would like to present examples of some of the new ideas that will secure the health service as the NHS celebrates its 70th birthday and moves beyond.
The NHS at 70. Well, I think fundamentally it's done what it set out to do, which has kept us all free from the fear of ill health. None of us in this country have to worry about the cost of ill health, and that is really almost unique across the world.
Well, I think we've got to a defining moment actually. It's a long time since Beveridge had his original vision, and I think there's a real need now to renew and refresh the NHS. I think we need to see some big shifts from what I would call repair to prevention and getting the incentives aligned along that route. We need to shift from a very fragmented system to one that's joined up. And we also have to fundamentally shift from a still very paternalistic system to one that's acutely personal with power given to the individual. I introduced, for example, the right to a personal health budget for people who are on long-term NHS continuing care.
So currently the NHS is focused on treating patients, and I think with the advent of a lot of the new genomic technologies and multi-omic technologies, if we can integrate that into the NHS infrastructure, then we can move towards a world whereby we can use this omic data to predict disease. So the NHS can move towards a prediction and a prevention function as opposed to a treatment function. And that allows doctors to work with their patients to say, actually, you're more likely or less likely to develop a specific disease, therefore you should modify your behaviors.
So I think when we go forwards, we're going to have to look at a funding structure that somehow takes into account that health and social care morph into each other at the margins and will do more so as we age.
So one is looking at the whole system. So that could be you as an individual as a whole, but also all of the NHS health and social care. And the only way you can do that is to understand what is happening at every single stage in your body or in the localities. And the only way to do that is to link data up. So for me, it's really actually have interoperable systems.
That has to involve digitalising the whole of the NHS so that we can take advantage of a unique data set that the NHS enjoys globally. And I see the opportunity for real collaboration with AI innovators to create things that will be of enormous value, using technology for the benefit of patients and the NHS. But the NHS has to get a model for how we collaborate with the private sector.
For example, peer support groups, online cognitive behaviour therapy, so that people get to really believe that there's things they can do for themselves. So they set goals.
You know, as GPs, we have to meet the needs of the modern patient, and that means embracing technology. Too long, the model of general practice has been making patients come in and see us face to face in 10-minute slots to get what they need. And actually, we have to kind of flip that on its head. And patients need to be starting their journey from home, accessing us digitally, and then us only seeing the patients we really need to see face to face.
Presuming that social care will increasingly get less and less funding, how do we strengthen local communities so that your pub, your coffee shop, your local newsagent is really the epicenter of the local community's healthcare? And how can we use digital to make those communities better linked up and healthier and therefore stronger?
A game changer for the NHS, to invest in non-medical interventions in the community for the millions of people who live with physical and mental pain, for whom hospitals really have very little to offer.
Giving individuals a slightly better mechanism by which to take responsibility, and I do think there's something around payments and the financials underpinning the NHS and how that's presented to an individual.
And that whole shift from that sort of paternalistic healthcare view is going to change. No longer will you go to your doctor and you ask them the question. I think already we're changing into that already in 2018, so in 2028 we'll be seeing a lot more How is it that patients are making their own decisions, not just patients but citizens, and how are information being used so people can make better decisions for themselves? So it's not just who do you go and see, but what will they say to you? So as a clinician, I will have a wealth of information, or I hope I will have a wealth of information at my fingertips.
So for me, the future of the NHS is about predicting and preventing disease rather than just treating disease.
And I think going forward for the NHS at 80, that patients and the public have to have far more responsibility for their own health and far more responsibility about the stewardship of NHS resources. And they also have to be accountable to the NHS in a far greater way than just paying taxes for it.